Hey parents, ever felt your child's forehead and instantly freaked out by how hot they are? Trust me, you're not alone. I've been there myself, as both a pediatrician and a parent. Here's the truth. Most fevers are harmless, but a few can be a sign of something way more serious. So, what are the 3 big red flags you absolutely cannot ignore when your child has a fever? And, just as important, when is it okay to take a deep breath and relax at home? Stick with me and let's break it all down parent to parent. Hi there and welcome to Dr. Ethan's Pediatric Health Tips. First up, let's bust the biggest myth ever. Fever is a disease itself. Truth is, a fever is not the disease in itself. It only means your child's immune system is doing its job, fighting off an infection like the cold or flu. And most of the time, this is normal, manageable. But sometimes it might be crossing the line, so here are 3 red flags that tell you a fever is now a dangerous one. Warning sign number 1. Your child is lethargic or unresponsive. If they're barely waking up, limp, can't keep their eyes open, or don't respond to your voice or touch, that's not just a sleepy kid. That's what we call lethargy, and it can point to serious infections like meningitis or sepsis. If your child is hard to wake or totally disengaged, don't wait. Head to the hospital right away. Warning sign number 2. Fast breathing. Does your child seem to be breathing fast? Are their chest muscles pulling in, nostrils flaring, or lips turning blue? Maybe you hear grunting or see them struggling to catch a breath. These are all signals your child isn't getting enough oxygen, and that could mean pneumonia, bronchiolitis, or something even more urgent. Remember, how your child breathes is more important than the number on the thermometer. If you see these signs, go straight to emergency care. Warning sign number 3, seizures or convulsion. A sudden spike in temperature can cause a febrile seizure, especially in kids between 6 months and 5 years old. If your child shakes uncontrollably, their eyes roll back or they go stiff, it's terrifying. You should visit the hospital once the seizure aborts. But if it doesn't in 5 minutes, call emergency immediately. So when can you relax? If your child has a low-grade fever, say a temperature between 37.5 and 38 degrees Celsius, it's most likely as a result of a viral infection. You can usually manage at home, monitoring the temperature. Offer lots of fluids, dress them lightly, and just keep an eye on their symptoms. If your kid recently had a vaccine shot, there might be a mild fever within the first 24 to 48 hours, but if it persists beyond that time, it should be of concern. Generally, I should say at this point that, irrespective of the less dangerous fevers mentioned, every fever must be evaluated by a doctor to know the cause, to ensure the cause is treated. So after managing at home for 24 to 48 hours, if it persists, please see a doctor. Now, what actually causes dangerous fevers? The biggest offenders are bacterial infections, like meningitis or urinary tract infections, severe viral illnesses like dengue or COVID, and inflammatory conditions. And remember, for babies under 3 months, any fever is an emergency. Always get them checked. So, quick recap. See a doctor if the fever lasts over 2 days, any of the 3 warning signs show up, or if your gut says something isn't right. Trust your instincts. You know your child best. Fever can be scary, but knowledge is your best medicine. If this video helped you breathe a little easier, give it a like and subscribe for more health tips from a fellow parent and pediatrician. Got a question? Drop it in the comments. I reply personally. I'm Dr. Ethan, helping you parent with confidence, not confusion. See you next time.